He's a kind and gentle soul. His heart is never cold. So peaceful and poetic, with a message true and bold. He's never seeking praise, so silent and so grave. And his transcendental love is the magic in his ways. And when I see his love, I know I've got a long, long way to go. When will I taste the love that he is feeling inside?
Hare Krishna. Welcome to our 18th episode of Seva Care Education. We have, I think, a very, very interesting program today presented by Gene Volovik, who is a medical practitioner, nurse, and great deal of different types of experiences. And the topic is going to be heart attacks. Very, very important topic to all of us, especially with our aging community. And many of our Seva Care volunteers, work with our community of devotees who are having health issues, hospital visits, and like that. And it's really important. I think this is really great information for us all to know about the recognition of heart attacks, etc. I'll read, here's our introduction. Heart attack is the leading cause of death in the United States. Someone has a heart attack every 40 seconds. Nearly half of the fatal heart attacks in the USA occur in women. Join Gene Volovik as he explains the basic of heart attacks, the risk factors, preventative strategies, warning signs and symptoms, and what to do while waiting for the EMS to arrive. What you do or don't do can mean a difference between life and death. Before I read his biography, I just want to say that that's exactly how a lot of us feel, that we might not really feel comfortable. We wouldn't know exactly what to do. What is the most helpful thing that we can do and how do we even recognize that someone is having a heart attack? So I think this is a very, very important and critical discussion we're having here. Tell you something a little bit about our presenter. Gene Volovik was born in the Ukraine, Soviet Union. After high school, he immigrated to Israel. During military service, he fell in love with first aid and CPR, became a combat battlefield medic. After active duty, he became an emergency medical technician at Magen David Adom, MDA, the main Israeli ambulance service system. He continued studying, became an EMT and a paramedic, working in the intensive care mobile unit in MDA. He went on to become an instructor for CPR and first aid. After immigrating to Montreal, Canada, Gene became an LVN and then an RN. He worked as an RN in the emergency department at Jewish General Hospital and also worked as a CPR and first aid instructor, teaching for universities, colleges, schools, and laypersons. After immigrating to the USA, he continued as an instructor, RN. He worked in the emergency department in Hayward, California. I can imagine that Gene has seen quite a few heart attacks in person. In about 2020, he and his family moved to Alachua, Florida. Currently, he's working at HCA North Florida with the Interventional Radiology and Neurology team, as well as being a hospice nurse at Haven Hospice. Not only has Gene been in the medical field since '92, he's a Reiki and Shiatsu practitioner and an Ayurvedic consultant. Gene came in contact with Krishna consciousness in 2020. He's been practicing devotional life since then. That was his main impetus for moving to Alachua, to be amongst the devotees. He's played music all his life since moving to Alachua and has been playing at kirtans, Rath Yatras, sadhu sanghas, and holy name festivals, or any other events promoting Krishna consciousness. He feels Krishna and the Vaishnav's mercy every day and is so grateful to be here now. And we're very grateful that you are here now with us, Gene. So without further ado, we'll let you go ahead with your presentation on dealing with heart attacks.
Thank you so much for introduction. Thank you everyone for coming and staying with us this day. This is a very important topic, as you mentioned, and it's very close to my heart, literally. Yes, I've been seeing many heart attacks, and I have few examples of people who I saw. One example was in my college back to Israel, we've been called somebody unconscious in college, and we're coming, and there's a person who I know. He was a gardener, and two young people doing CPR on him. So we just continue our work, and eventually we brought him back to life, and he back to work. So this is one example when CPR was done right away when the person fell and had some heart issues, heart attack. And another example, and I've seen it many times, when you're coming and nobody did CPR, and you basically pronounced death on arrival because nobody knew what to do. So this is really important, and this is one of the reasons I became instructor, just to bring this knowledge to lay people, because most of the heart attacks happening with somebody we know. It's very rare, like it's in the movie, you can like you walking on the street, somebody there. But most of the time it's happening somebody you know, at home, at work, friends. So in my opinion, it's very important to know what to do, how to recognize it, and what to do until advanced help arrives. So let me share screen. As we said, we're talking about heart attacks, and this is educational review and not personal medical advice. So just to bring you awareness, what it is, how to recognize it, and what to do. So heart attack happens when the blood flow to part of a heart muscle is suddenly reduced or stopped. Most commonly this happened when there's occlusion by clot or fatty plaque. And heart muscle needs oxygen all the time. So when this supply abruptly stopped, the damage to the muscle that hasn't received the supply starts suffering. And that's why we're saying time is muscle, because the more time this muscle suffering, the eventually it became dead and there is no way back. So you see on the screen this part of muscle right now. This is where the plaque is. So the rest of the heart muscle below that will die eventually if nothing happening. So how we can recognize and what to do in the first minutes when it happens. So people usually waiting, they're not sure like why so many people dying, because it's hard to, like there's classical symptoms and there is not classical, and we'll talk about that. But people unsure what to do. We know that some men stubborn and don't want to go to a hospital, and this is what's happening. And so they're stubborn, they're embarrassed, they waiting, and muscle dying at the same time. So calling 911, it's very safe. You just call, and it's better than driving by yourself. Recently, I had one of the patients who was driving and had heart attack while he was driving, and he hit the tree. It was close to his house, so his wife actually ran and did CPR on him. But eventually he became what we call like, he had some brain damage, and he never recovered from that. Because as we're saying, all body depends on oxygen, and brain and heart like really demanding oxygen and sugar. So if there is no blood flow that's supplying those essential elements to brain or heart, brain will die first, and heart needs more oxygen. So that's why CPR will start pumping right away, just to bring oxygen to blood and to the brain. So calling 911 is safer than driving by yourself. And emergency response can assess the person and start care even on the phone, tell what to do, and sending ambulance, of course. So in the United States, I would say heart attack it's not rare event, and CDC reported more than 800,000 heart attacks per year, and many of those first-time events. So 600,000 first heart attacks. Some of them silent, meaning there is damage happening, but person doesn't feel it. There is no pain. Like so we're saying, like sharp pain to the chest. So some people won't experience it, especially women and elderly. So that's why important to understand that symptoms can vary from person to person. And we'll go over it later, so you'll have some knowledge about how to recognize it. Another data that heart attack is a broad category, and it remained the leading cause of death in the United States. As you see, more than cancer and accidents, and the death still the higher, like 600 and above people dying from first heart attack. And with the time, we see that amount of death from heart attack decline due to better response, better recognition, hospital treatment, and preventative medicine. And even back to Israel, I remember we were talking about in some states and some places in the States, to get your driving license, you need to do CPR course. So, and on those areas, the death from heart attacks diminished only due to this vital action. So I really think that by knowing what to do and taking CPR courses is very beneficial. So better emergency system, aspirin, stents, and medical help. This is the measurement that reduced heart attacks with awareness and people taking action. It's easy today with cell phone, call 911, and they can lead you what to do until help arrives. Then, like 20 years ago, you need to find some phone somewhere and call them. But it's still leading cause. Just keep in mind that this is still leading cause and it's very serious. So the heart is not just a symbol, it's a muscle, it's a pump. So as you see, we have different chambers, and in the blue, it's veins. It's just colored for purpose. So it's like deoxygenated blood coming back to heart, and it's pumping blood to lungs, get rid of all the waste products and CO2 and get oxygen, and then oxygenated blood coming on the left side and going to the rest of the body through this part. It's called aortic arch. And also, since heart is also muscle, it's supposed to receive blood from somewhere also. So as you see, those two coronary arteries that supply blood to the heart. And when the block happening somewhere there, the muscle that not receiving the blood with oxygen will die. So you see here those two entrances of main arteries, coronary arteries, and then there's some branches. And one of the preventative things we're talking about collateral vessels means, imagine this is a main road and there's some block and there is no extra roads like we have 75, right? We have from Alachi to Gainesville, this part, if you stuck there, you stuck, you can go anywhere. But by doing some cardiovascular exercises, running, walking, biking, you increase demand of muscle. And when demand to get oxygen increased by nature, by design. We will develop extra vessels, and this will be helpful in the time of some occlusion, if person being healthy and being active. The emphasis on active. Being active means physically active. So they develop more vessels, and this will help to decrease damage if it's happening, or even avoid it. Because one of the things that we're doing today, it's called like cabbage. Basically, they're taking some arteries, some vessels, and creating bypass, coronary bypass, if you heard about it. So why not to do it naturally when we can do it today, not waiting till it's happening? And then this is already like, it's not preventative, it's already treatment. So really encouraging information to take health in our hands and then do some active exercises to increase heartbeat, which will increase oxygen demand, which will help to develop those collateral vessels. And this is the reason why first timer who have first time heart attack dying more than 600,000 because they never developed these collateral vessels. So first occlusion, especially on this LAD, this is called widowmaker. So if there's occlusion in the top, let's say, all this muscle will die if there is no intervention. So you can understand why it's important to create collateral vessels and do exercises. So what's happening inside of the heart? So atherosclerosis, this is hardening of vessels inside due to plaque. Plaque, you see the yellow part that build up, and it's related to cholesterol and lifestyle. So let's say you're not doing any exercises and you're eating, like you pre-diabetic or diabetic already. So blood became viscous, very thin, and very thick. Imagine like honey consistency, right? So it's slowly going through the passage. So it's not pressing on the walls, the blood pressure changes, and deposit of the fatty materials underlying will narrow the passage. And you see in one point it's so narrow that even small thing will block it. So blood clot can suddenly form. And sometimes, oh, perfect, okay. So what's happening, the blockage, when it's created, as we said, somewhere here, the oxygen won't reach the body muscles, and it's called ischemia, basically injury to the muscle, and this is where the damage starts from this moment. From the second there is block occurred. You've probably seen it in the TV. So there's few different kind of blockage. One is called STEMI, means ST elevation MI. MI stands for myocardial infarction. And so there is different letter for different peaks and EKG. So ST, this is S, this is T, and this is part elevated, as you see here, ST elevation. This is one of the diagnostic tools, so for our purpose it doesn't matter. But just to show you, STEMI means it's a complete blockage or near complete blockage, and there is non-STEMI. You see there is no elevation, so less impact to the heart muscle, but still there is still a problem. There's still impact and it's also still dangerous. So both of them need urgent medical care. So what kind of symptoms we have? So there is some classic symptoms. Pressure, squeezing, sharp pain on the chest. It can radiate to jaw, back, stomach, neck, some cold sweat, and the person can be dizzy, can start vomiting. And symptoms can stay or can go away and come back. So, recommendation, when you feel it, don't hesitate, don't take chance. Just call 911 and say this is what's happening. Especially if you're predisposed, it means like if you have some relatives who had heart attack, or some diabetes, or any other medical things going on. Also, shortness of breath can occur, and with or without chest discomfort. And there are some symptoms that's related to, so this is classical symptoms, there's not classical symptoms. So what you see, other symptoms can be like cold sweat, nausea, vomiting, and dizziness, lightheadedness, preventing or fainting, unusual weakness, extreme fatigue, or feeling anxiety or like doom. And some people feeling like, man, I'm going to die. I feel it. So believe them. And skin or color also will change, might change. Bluish, pale gray, it means less blood coming to periphery, and those symptoms of shock. So body in shock and trying to preserve all blood to main organs, brain and heart. So that's why you feel cold, sweat, and change in your skin color. Dizziness also because there's not so much blood coming to brain, so it starts feeling dizzy. And for women, special symptoms, so it's called atypical. So we have the typical symptoms and atypical, and that's why more women dying than men, because men have, despite their stubbornness, not to go there to hospital, women can have a heart attack without knowing. Or some shortness of breath, or I feel tired, maybe I'll just lie down, or maybe, oh, I feel like it's cold symptoms, so it's hard to diagnose it right away. So they have like shortness of breath or nausea, and it's not so prominent like as a man. So this is just keep in consideration if there's something happening unusual, especially sudden, like suddenly there is some shortness of breath out of blue without any indication, or extreme fatigue. Consider going to hospital and be checked. Also, some like diabetic patients, they also will experience atypical symptoms, because diabetes will decrease sensation, nerve sensation, and neuropathy, and person can experience like full STEMI impact, like HT elevation MI that we said it's more dangerous, and without any pain, because usually we put attention when we have pain somewhere. That's how it starts acting. Oh, there's pain. What's going on? And for seniors as well, silent MI, meaning without typical symptoms, it's very relevant and present. So the same, shortness of breath, sudden shortness of breath, fatigue, overwhelming tiredness, and can be also mental changes, some confusion, delirium, or feeling disoriented. Some nausea and vomiting can be, dizziness. So kind of the same symptoms as the women can experience, the same elderly, disregard women or men can experience it. So the bottom line, just be aware the symptoms can vary, and don't take chance. It's better to be checked and rule out than be sorry. And especially for loved ones, like, oh, somebody, like, let's say, wife experiencing some shortness of breath out of blue, feel tired. Okay, honey, let's take you to be checked. Just do cardiogram. So when you come into hospital, they do diagnosis, and we'll talk about it in a few minutes, but basically they check your enzyme, check your blood, and do cardiogram, and we'll decide what to do next. But this is the main things: cardiogram, history, what happened, cardiogram, and blood. On ambulance, we don't have bloods, so we based on history and cardiogram. So we can start treating in the ambulance. Because heart is muscle, and the faster you're treating, the better the outcome. So when call 911, call 911 for chest pain or pressure lasting more than 3 to 5 minutes and can come and come back, and or shortness of breath. If it's atypical, any of those symptoms that coming and they not vanish after rest, let's say I have difficulty breathing and you're sitting 5 minutes and it's gone away and then coming back while you rested, there's something abnormal, because usually when you rest, the symptoms goes away and won't come back. Try not to drive. I mean, if you're somewhere and like there's no other way to get to you, it's in the middle of desert, yeah, you have no other options. But if you can, just stay there, relax, because when you're driving, you're in stress and especially in pain. So you're kind of increasing your oxygen demand to the heart. And we remember, like, when the heart needs more oxygen, we need to supply it, right? So more, if there's no oxygen delivered, the heart will die even quickly, this part of the heart. And if somebody stay with this person and help, just open the short, let them rest, monitor them. And when you're taking CPR courses, they will go deeply what to do exactly and what to do when the person has chest pain and possible heart attack. Okay, so here we go. Have person stop activity and rest. This is to reduce this demand, oxygen demand. Call 911. Hey, I have 55 years old female experiencing shortness of breath, out of blue, feel fatigue. She's sitting now, resting, and they will tell you what to do. They will dispatch ambulance and be with you online and help you to stay with the person and instruct you what to do. So if the person has aspirin, no contraindication like bleeding or allergy, it's good idea to take aspirin. Aspirin saves life in these situations. It's helping. So when the plaque created, aspirin is a medication that help this plaque to dissolve or at least stay small. So imagine you're on a boat and there's like something hitting the boat and you have now a hole and there is nothing can stop it. And so there's like aspirin, it's preventing from creating of plaque, right? And plaque, this is kind of the situation on the boat when you need to stop this bleeding, stop the water pouring inside, and you're trying to close it with different things just to keep it blocked. So this is what happened in the blood. When there is some problems in the bloodstream inside of the lumen, let's go back. I'll show you if I can go. No, probably not. Yeah. So what's happening? Let's say this one is ruptured in one point. This is one of the reasons for heart attack, that it's ruptured, and I think it was here, the plug. Here. So this part is ruptured and plaque created just to hold this area intact. So the same happening on the boat, right? When you have like hole and we're trying to block it. So aspirin helping to dissolve this plaque, so the blood can continue flowing. So aspirin, relaxation. If they're using nitroglycerin already, they've been prescribed. They had it's called angina pectoris. It means they predisposed already. They have narrowing of the vessels already. So nitroglycerin will open this passage of the coronary vessels, will open it up. It's what's called vasodilator. It's dilating the tubes, let's say, right? So they can take up to 3 times every 5 minutes. They can take the dosage 0.4 milligrams, so just spray it under the tongue a few times. Just be careful because this can bring blood pressure very low, so they should be sitting or even like half sitting with head elevated, half torso elevated, and legs elevated also. So if they become unconscious, syncopated, you can just gently lie them down and help the blood flow go to the brain. So if there is nothing available, you just stay with them, make them comfortable, open the shirt, and stay with them. If person became unresponsive, so there is distinction between heart attack and cardiac arrest. So heart attack, we said this is impact on the muscle, but when it became at one point, it can turn to cardiac arrest. It means that the pump, our hearts, stop beating properly and delivering blood to the rest of the body. And how we know it? Just palpating the pulse. So how we see it? We see person became unresponsible. Suddenly become unresponsible. So if you haven't called yet 911, call now. And part of CPR, like push hard and fast. So we became the muscle. We start pushing blood. And using AED, automatic external defibrillator. Defibrillator, this machine, we probably saw it in the movies when they're shocking people, like 2 pads, like shh, boom. So this is manual one. And on the field, like if you're paramedic and you learn how to do it, or doctor in the hospital, you know how to operate it, you're using manual one. On the field, and actually now we have in a community, we have in temple, it's automatic one. You just apply pads and it will define the rhythm and will give shock if needed. So what's happening, each cell in the muscle, in heart muscle, can produce electrical stimuli. And this is how our heart works, through the electrical impulse. But when the muscle get injured, different, it's called ectopic beats. So electrical beats from different areas start shooting message, hey, I'm dying, help me, help me, help me. So heart muscle, instead of pumping as supposed to do, start like quivering. It's like jello. It's not moving properly. And this is what's happening. This is one of the dead arrhythmias. It's called ventricular fibrillation. So it fibrillating the ventricles, the lower part of the heart, that pushing blood to the, especially left one, that pushing blood to all body. And when happening, we need some electrical stimulus that will shut all those small electrical impulses. And this is what AED does. And AED saves lives, like guarantee. I've seen so many times. So this is on the right upper part. You see the yellow one. They can be different colors, but usually this is how they look like. 2 buttons, green and red. Red for charging, and green or blue it can be, or whatever color. So when you get this AED, you open it up, press the button, and the machine will tell you what to do. Hey, open the chest, put the pads, and you have pads for kids and adults, and will tell you what to do. You just follow what it tells you. So in our temple, on male side, on the left side, when you exit the door, there is AED. And AED saves lives. So when you open the door, it will beep. Don't worry, just open it, grab it, and close it. And as I mentioned in the previous example, so when I moved to Canada, and at one point I was a first responder in a school of nurses, I told them about this accident that we had in Israel when the early CPR saved lives, and especially AED. And I tried to push the school board to bring AED and integrate it in our school. And I told them, like, this is saves life, and this is what happened. And imagine you have so many professors, adults, it's adult education. So everything can happen. We just need and back then it was expensive. But if you can save life, who cares about money? I mean, designed to save lives. And they said, like, yeah, thank you for information, but now we're not ready. And one day I was away, coming back to work, and guess what? It happened. Some of the professors just he was in the restroom and they found him unconscious. They called paramedics. It took 10-15 minutes, and they didn't know what to do, and he died. So after that, they implemented AED everywhere. But this life could be saved, if they did the CPR courses and at least put the AED. So I'm so glad we have AED right now, and it's easy to operate. Press button, it will tell you. We put one pad, another one, and it will tell you continue pumping, stop, analyzing, okay, charge or not charge, don't touch. So we tell you everything. Okay, so very important. And it's part of CPR courses, so if you decide to do it, you'll know what it is and how to operate it. And very important to continue doing CPR courses every 2 years, usually recertification every 2 years, because you will see it's skill that takes time. And if you're not using it, you will lose it, you will forget it. Guarantee. Like I haven't done CPR for maybe like a year and a half, 2 years. And for sure, like I will not push hard, do some mistakes. I remember when I came to Montreal and I was like fresh out of field. And when I did this instructor courses, we did some competition. And I remember what to do because I did it like yesterday. I just finished it, right? And as paramedic, you're doing it very often. And it's skill. So very important, continue doing it every 2 years at least. So it's still in your mind and it can save life basically. So the more you prepare, the more you know, the less you regret that you didn't do it properly. And we talk about that hospital confirmed heart attack by, as we said, ST elevation, this part. So here we don't have it. And troponin, it's one of this. There's troponin, there's other enzymes that have been checked. And this is how they determine that there's impact and they're treating accordingly. So bringing a person faster to hospital, it's very important. In a hospital, after they determine it, there's few things they can do to open the occluded area. Or they can do PCI, it's percutaneous coronary intervention. So it means they go inside of the artery and they open it with a balloon, kind of squeezing everything out to the internal wall of this particular place, open it up and putting some stent so it stay open. Or they can do bypass if this area massive or it's occluded already and too long to get to hospital. So So there's different options, or they can also give some medication, streptokinase, like different medication that can open it chemically. And I remember we had a pilot protocol in Israel when you start this on the ambulance right away, if you have some indications. And I think we see it also here in the States for sure. They can start it if person falling into a category that it's safe to give them this medication, they can start it right away. Clot busting medications. Yeah. Okay. So this is part of the medication. Antiplatelets, this is what we said about aspirin. So it's creating, it's diffusing platelets. Platelets part of the blood chemicals inside that they create plaque, right? So this is preventing clot, antiplatelets like aspirin. Statins will decrease cholesterol, but about the statins, there's a lot of different researches. So we'll go with the American Heart Association, keep statins there. Beta blockers, one of the medication that decreasing heart rate. And why it's important, as you remember, we talked about increasing it when you doing sport to increase oxygen demand of this muscle. Now, when you have already impact, you have damage to the heart, you want to decrease oxygen demand. So if something happening, you run to catch a bus or somebody scared you, your heart won't start pumping fast, which will increase oxygen demand. And since you can't supply it, you can get another heart attack, basically, because muscle asking for oxygen and you can't supply it more than you can at this point. So beta blocker very important. And blood pressure, diabetes medication just for risk control. So it depends on what happening, who you are. So it's very specific what doctors will prescribe. And very important, so recovery in cardiac rehabilitation centers, important, because if a heart attack happened, it can happen again. So they working on helping an individual get to the best shape they can, continue preventing another recurrent episode, and try to get person to the highest level of their life, right? Because sometimes the impact so massive that people have problem. There's life before heart attack and life after heart attack. So it can be really totally two different part of the life. So they're trying to bring it as much possible to higher lifestyle of the person. So very important when you discharge to ask referral to get there. And they're doing exercises, education, counseling, and control of risk factors. Everything based basically on education. When you know it, you can choose to do it or not and what to do, right? As we know. So risk factors that you can act on. So there are some risk factors we can't act. Today it's debate like gender and age. Age for sure we can change. Now gender, in some places you can. But still, it's kind of anecdotal. So risk factors that you can change: your blood pressure, cholesterol level, diabetes, smoking, and inactivity. So we kind of talk about some of them. And inactivity, start acting now, do some walking, fast walking, swimming, biking, smoking. Well, we don't smoke, but for some of us, our friends suggest to do those things. Prevent diabetes by proper diet, cholesterol and blood pressure also depends on the diet. And as we know from Ayurvedic perspective, those all things also, it's dinacharya. It's like what you eat, your diet, and your lifestyle. When you wake up, if you're active, what you eat, how you eat. So all those principles very, very important and correlated to heart attacks. And people who have heart attacks, they might develop strokes as well. So those things with vessels and blood clots, they're so related to each other. And it's like cascade. If something happening, it can trigger another things and another thing. So here we go. Essential 8 lifestyle preventions according to American Heart Association. As we said, eat better, be active, quit tobacco, sleep better, control your weight, cholesterol, blood sugar, and blood pressure. So this is daily habits and medical checkup just to see where you're at with enzyme, do some cardiogram, electrical cardiogram once in a while just to see where you're at, what your baseline, like cholesterol level, weight management, and learn CPR with AED skills. Very important. I think this is the most important with knowing the symptoms. And that's it, some references. I think that's it. Let me stop presentation and go to questions.
Well, thank you so much, Gene. That was very, very helpful, I thought. We'll take questions for some of the people that are here with us. I had one to begin with. And, talking about how important it is to refresh ourselves on CPR. I've taken the course 3 or 4 times, but it's hard to remember always everything. And like I was just thinking, when you were talking about the difference between a heart attack and heart arrest. In other words, one can have a heart attack, and you said that might lead to heart arrest, the heart stoppage, right? Now, you wouldn't begin CPR as long as there was a heartbeat and breathing, right?
Yeah. It's only when person became unconscious, and first things you check in breathing and you're checking pulse. If there is no pulse,
yeah. And usually those will go together, won't they? The pulse and in other words, if a person, I don't know, I'm not sure.
Yeah. So if you can lose your breathing, but still heart will be beeping.
Right.
And eventually it will stop. If you have no breathing, your heart will already...
With no oxygen. So that's why you would need to start CPR to get oxygen going to the heart.
Right. Yes, exactly.
Yeah.
By pressing fast and deep, you continue pumping blood.
Right.
Important.
Okay. Are there any other questions? People can...
Yes. Thank you very much, Gene, for this very detailed explanation of the anatomy and physiology as well. I just wanted to emphasize that young people can also have heart attacks. I know personally several people in their early 40s without any previous history had a massive heart attack and died. And also within our devotee community, this has happened several times. Young people in the 50, they've had sudden heart attacks and died. So it doesn't happen to people, 60 and above. It can happen at any age. There was a friend of ours who went to Florida from Canada to have was having a great time in Tampa, I think it was. He's only in his 30s and had a heart attack there. Had to be transported back to Canada. So it can happen at any age.
Yes.
And I want to say, go ahead.
Yeah, just follow on this point. It's related. I mean, there's so many different factors, but mostly it's like sedentary lifestyle, like diet. So it's very important, those preventative things that we talk about, like dinacharya, lifestyle and diet, very important to be active. And especially after COVID, we had so many even, athletes who fell and they have a cardiomyopathy. So there's so many things. Just you're right. I forgot to mention that can happen to at any age. It's very important to keep it in mind. Yeah.
Yeah, there was a example in our community of a not very old devotee who worked out a lot. Was very, very healthy, and he had a heart attack. But because he'd been so healthy, he had a lot of collateral vessels in his heart, and because of that, he was saved.
Yeah. Example, like from the book, develop your collateral vessels. And this is only can be developed by exercising.
Mm-hmm.
Yeah, that's why I love this knowledge. I mean, this is very important just to know it. And so many things can be prevented for us, for ourselves, for our friends, loved one, just by properly eating and exercising, doing those preventative things.
Mm-hmm.
And CPR courses, very important.
Yeah.
CPR courses, it's just save life.
So we did have Seva Care sponsored a CPR course. I think it's been a year or so. So we do plan to do it regularly, at least annually. And we had a full house. It was done by Safety Net. So they came to the ALA cafeteria and did a whole program, and people could get certified there. And they had their mannequins and everything, AED machine. So we plan to do that again.
Yeah, in this college where we had this gardener who fell and came back, they invited us. We were doing CPR every 3 months. We did some courses in all the classes, install all the AEDs. So they were like, when you realize how important it is, you will put money and effort just to bring it to community. So the more people know about it and doing CPR courses, the better the outcome.
Got a question, slightly different, but related, as far as cardiovascular health. I mean, another thing that we might encounter is people having strokes. I know that's not our topic today, but could you say something quickly about is there a difference in how you would recognize a stroke from a heart attack?
Yeah, a stroke, it's a blockage, but in the brain, right? So the same principle.
Oh.
The part of the brain lacking oxygen and sugar, this is what the brain working on. And then we have symptoms, it's called phase. So you have depends where it's in the brain, but sudden weakness on one part of the body, a slow speech, droops, facial droop, gaze, a person can cross the midline with the gaze, can follow with the pupil, can move eyes, weakness on the one part of the body, like limbs, arm and leg. Or it can be just, for some people, it can be just disorientation or confusion suddenly. But you'll see some change in sensory and in motorica, in the emotional outcome. So
and if we experienced those or we saw somebody who had those types of symptoms, we would do what?
911 and monitor them, because the field, at home you can't do anything. They're coming to us and we're going inside and removing the clothes.
Okay, so they need emergency medical attention.
Right away, don't wait. Heart muscle and brain is also, time is brain. It's very crucial, 90 minutes window. We're actually monitoring when the person arrives, how fast we're doing clot. And this is what I'm actually doing now in interventional radiology. People coming and we're removing blocks, or there's some aneurysm or different things, heart, brain hemorrhage, especially after somebody fell. A few days ago, they fell, especially in older, we see it it's called subarachnoid hemorrhage. It's slow developing, you don't feel it, but slowly they start developing some symptoms, get confused, there's some weakness, tiredness, don't wait. Go check.
Right.
We're going to do I think there's going to be an educational thing about stroke, right?
Yeah.
Mhm.
Yes.
Yeah.
And your daughter's going to do it.
Yes.
Idea.
And so the thing I just wanted to say, quick thing, if you do call 911, then you have to tell them that you think they're having a stroke, because there's a special ambulance that comes when they think you're having a stroke in
Nice.
this area, So
They could do on-site assessment. I think they have portable CTs. Isn't that
yes.
what they?
Don't wait.
Yeah.
From experience, it will take forever. Just rush to hospital. They do ACT, doing angiogram, dry and doing wet, and on the table faster. We had some people flying from different area, and they took this ambulance. Took them for a while to establish IV, to press some. I mean, it was horrible. Just kind of taking time. So.
So strokes can also happen not just from clots, but also from hemorrhaging.
Yeah.
And especially in elderly, it's happening slowly, so it's not sudden. When something's happening sudden, you kind of will act faster. But if it's slow, and especially somebody lives alone, he fell after a few days, not picking up phone or get confused, So with elderly, there's more precautions and just thinking about, okay, if he fell even a week ago, it can develop now. So
well, that's why we have our neighborly care program, where we encourage devotees to be aware of who lives around them, and if there's any elderly, to keep an eye. If they haven't seen them in a day or so, see what's going on, check in on them, or you could call even 911 and they'll do a wellness check on them to make sure that they're okay.
Mm-hmm.
I have a philosophical question. We can try to resuscitate them, and the chances of them surviving heart attack are greater the quicker we act and do the AED, et cetera, et cetera. But how do you jive the philosophy, that we think that if they're meant to live, they'll live, and if they're meant to die, they'll die. And sometimes people use that as a way to not take immediate action.
I think the body was given by Krishna, by God, and we need to keep it and do as much as we can. From our perspective, and as provider, I'll do the maximum I can do. It's my dharma. So there's no, okay, he's dying, and who am I to intervene? I'm doing what I've been there for. Save life, and see it as a vessel that's been given to us, and we need to keep it intact as much as possible, and to do whatever we can do until the last minute. So that's how I see it.
And I also want to add that was very good. Yeah, I really appreciate what you said. I'd also add to that may also be part of Krishna's plan, to send that person or have that, get the person to the hospital. In other words, I know myself, I've had a couple situations that could have very much been fatal in my own life, but somehow or another, I was saved in that. And one of them was almost by pure chance, but another was because of medical intervention. So, you can say, well, who are we to say? But who are we to say that Krishna doesn't want us to have all of these opportunities, as you said, to save this body, which is Krishna's body, meant for our service, to continue. So, yeah.
To do the best we can.
Right. And if it's another devotee, then obviously part of our duty to each other, to care for devotees and to serve devotees, is to try to help them in any way we can, whether it's spiritually or whether it's through saving their life. for helping them, helping their life, medically or however.
And part of it's education. That's what we're doing, to bring awareness to everyone that this is what you can do. You can implement preventative measures just by eating, walking. You can decrease your chance of big heart attack.
The worst thing is, okay, so you have a heart attack or stroke or whatever, that you don't, the worst thing is, well, the best thing would be if you died, but the worst thing is if you're left with a disability to deal with, which is very difficult. So those are the negative side effects of not acting right away or taking care of yourself during your life.
Yes.
You end up with a huge disability.
Yeah, the example I gave about the patient who was driving and had heart attack, he was young, 50, 56, 59, young guy, basically. But yeah, and wife starts CPR and they arrive later. So he had some some brain damage, and he became bedbounded, and she took great care of him. I really admired what she put her life to serve him, and eventually he died like a few weeks ago. But she did maximum what she could, you know. So keeping your skills on the top and do what you can. CPR very important.
Okay, we're almost at we are at the end of our time now. Were there any other questions? Anybody else here have any final things, questions, or comments on the topic? If not, well, once again, thank you so much, Gene, for a very, very interesting talk, very thorough, obviously very educational, scientific, as well as really understanding the situation, and very practical in terms of things that we can do preventatively, things that we can do if we see a heart attack in process, a good call for all of us to learn CPR, AED, and all that. And, it was after that CPR course that became the impetus. Then we started pushing forward to get the AED into the temple room, which is, as you said, there's no question about they save lives. And so it's like we need to do whatever we can do. So I just think this is just very important part of devotee care. And again, thank you so much for your presentation and all of your service to devotees.
Thank you. Thank you very much.
Thank you very much. Jaya Prabhupada. Haribol. And join us again next month for our for another Seva Care educational episode. Keep in tune.
You'll find no lust and greed in a heart that's pure and free. He's a lover of the Lord, and his life is ecstasy. He only dies to live, and living tries to give the happiness that's found in the sound of Krishna's name. And when I see his love, I know I've got a long, long way to go. When will I taste the love that he is feeling inside?